Welcome to the BioBalance Healthcast. I'm Dr. Kathy Maupin.
And I'm Brett Newcomb, and today we're talking about chronic fatigue. And I'm going to try to take it seriously because every time I hear the phrase chronic fatigue, I think about the Madeline Kahn song in the movie Blazing Saddles. And not so much about the words of the song, but the depiction of someone suffering from chronic fatigue. And so that's where my mind goes. But it is an important conversation, it is an important topic. Kathy, why?
It's very serious just because so many people think they have chronic fatigue, but they have just ordinary fatigue.
Just plain old fatigue.
Chronic fatigue is different. And it's important to me because many of my patients come to me as a last resort to replace their testosterone so that they can get their chronic fatigue taken care of. And it does work about 70% of the time. So 3 out of 10 people don't get a lot better on testosterone pellets.
3 out of 10 people that have been diagnosed with chronic fatigue.
Yes.
Not who just think they're tired all the time.
Right. No, the actual fatigue generally gets better with replacement of hormones.
And there are 3 or 4 different modalities for delivering testosterone. Do they all work with that efficiency level?
No, most of the patients have already tried testosterone in other forms, but when I treat them with pellets, which go under the skin and give you a higher level constantly of testosterone than oral creams, gels, vaginal, all of those other forms, then we'd have a much better success rate. In fact, most people don't get better on just those other forms of testosterone. However, this is a big deal because there's not a lot of treatment for chronic fatigue. People, they tell you just like mono, go home and sleep and eat and drink a lot of water and basically
Rest.
You check out of life.
Yeah.
And most people don't have the luxury of doing that.
Well, how do you differentiate then? If I'm tired a lot and I'm going through a period of intense stress and it's really weighing me down, that's not necessarily chronic fatigue. I might think so because it's pretty overwhelming. But someone that suffers from chronic fatigue, what do you look for?
Well, there are 3 very common symptoms, and those are a severe fatigue after you have a flu-like illness.
Okay.
So you have fever and you have a cough and you have upper respiratory symptoms and fatigue with that, but the fatigue never gets better when the rest
So
of
the flu alleviates, but the fatigue does not.
Right, and it's not really flu, but it's flu-like. It's an upper respiratory kind of problem. But that's one of the big symptoms. Not everyone has that. But then a lot of people tell me that the second one is that when people tell me they don't feel better after exercising anymore. They used to always feel better. They used to be energized.
They don't get that runner's high.
They don't get the runner's high. In fact, they're exhausted after they exercise, and usually by the time they've seen me, they've stopped exercising. And then about half of the patients get night sweats. And night sweats that aren't hot flashes, that aren't...
And how do you know the difference?
Well, you know the difference by doing blood tests,
Okay.
and you know the difference by replacing estrogen or testosterone and seeing if the night
If it
sweats
goes
go
away.
away. But usually the treatment for chronic fatigue in terms of pellet therapy or testosterone therapy is a longer time period where you just can't feel better. You have to go 3 months maybe on these before you even feel somewhat better. So if we're just talking about just general fatigue, then it'll get better right away.
Okay. So doctors use a diagnostic manual to help them make an accurate diagnosis. And in my field, we have the DSM, the Diagnostic and Statistical Manual. And we look to see if we think it's a particular diagnosis. It'll say there's 8 characteristics and they have to have at least 3 of these and
Right.
4 of those and so on. Do you have that for chronic fatigue?
Yeah, and chronic fatigue is generally diagnosed by symptoms, unlike other illnesses. It's not always diagnosed by lab. So you have to have 4 or more of the following symptoms. You have to have difficulty remembering things, having difficulty concentrating.
You mean like a list of symptoms?
Thank you. I don't have chronic fatigue, thank you. And usually you have a sore throat, a long-term sore throat. Generally, you'll have lymph nodes that come up here at the back of your head and under your arms that we can palpate or feel.
They're
When we
swollen
examine, you usually can't feel a lymph node.
Oh, okay.
So when we check you over, and if they're back here under your arms and up here above your clavicle, then that fulfills one of these criteria. So muscle pain, joint pain, new headaches, and sleep that's not refreshing. And the last one is the post-exertional fatigue, where every time you exercise, you get tired. So those are the things that we look at, and you have to have 4 of those to have chronic fatigue.
Okay. And that has to be consistent and enduring over a period of time?
Sadly, it's usually enduring over a long period of time, and there's no really good treatment for it under most circumstances. The real issue with chronic fatigue is that your immune system is low when you get this. In other words, people with an intact immune system who are they get sick. We all get sick. We all get viruses, and we get over them by our immune system kicking in, our blood cells, our T cells, killing the viruses or killing the bacteria, and then we're better. And that's usually a short-term thing. The problem with chronic fatigue is usually the immune system has been made very inactive. It's been suppressed by long-term stress or dieting or loss of hormones.
Yeah.
Because loss of testosterone decreases the activity of your white cells. So you're a setup for getting something if your immune system is low.
Right.
And then when you get a virus and it is ongoing, and if it's a particular virus or a particular bacteria, then this can be ongoing and it can be very difficult to treat. It's not treated by usual antibiotics for 10 days. You have to take antibiotics for 6 months.
Oh, wow.
It's very difficult to treat, but by adding testosterone, we improve the immune system response.
Yeah.
And so for me, that makes me look great because all I'm doing is giving them their hormones back, and they start getting their immune system back, and they start fighting this. So that's one of those things that I really feel, I mean, it's awesome when you can treat somebody for this kind of an illness that has debilitated them, and they are now whole again.
So in some respects, you might think of it as a secondary gain because providing testosterone or estrogen is normally done for other reasons.
Right.
And if this also exists as a problem, then it's a secondary win. It's win-win. You
Right,
win on
that's true.
multiple levels.
And usually people who get this win on other levels in terms of their bodies coming back, their muscles coming back, they look younger, their skin's better. All of those other things come back as well.
And we want to remind people again that one of the functional reasons that this works is the methodology of delivery system. Because the under-the-skin pellets, the bioidentical pellets that you use, have a consistent absorption rate. They don't spike in a metabolic curve the way other delivery systems do.
Which means when you take a medication, if you're taking oral, usually it goes way up and way down over 24 hours if you take it once a day. If it's twice a day, up and down, 12 hours, up and down another 12 hours. Same with any other type of delivery system, including sublingual, vaginal tabs, creams, gels. Creams and gels are the hardest to get a steady state on. They go up and down all day. You have to apply them all day long. So to treat this illness, you need to have a steady state of testosterone and estradiol if necessary. A lot of people get this before menopause. They get it after 40 when their testosterone drops. So when we replace that and their immune system kicks back in, but it doesn't have to keep catching up for all the peaks and valleys that you get with other forms of testosterone.
Right. So why do doctors not diagnose this more quickly than they do?
Well, fatigue is the biggest issue when for a doctor. Everybody comes in and says, "I'm tired."
Right.
And this is not just "I'm tired," I'm overbooked.
It's a really imprecise term. It's
Right.
not measurable the way
It could be 40 diseases or more.
Right.
So a doctor listens to fatigue and he goes, "Psh," he can't possibly check you for all 40 diseases. So he or she is looking at you and saying, "Oh, tired." She has a job and she takes care of her kids and it's a holiday, so she's tired. So they sometimes overlook it and don't go through that whole list of symptoms.
Or they do a slow burn triage. So let's try to treat this because it could be that you're coming down with
Right.
that. Or let's try this, it could be stress. Let's wait till the holidays are over.
Right.
And so time passes. And we're back to the idea that chronic fatigue
It's
is
chronic.
an enduring chronic,
Yeah.
not acute, an acute infection or an acute problem of stress or what have you. So the relationship between the doctor and the patient has to be good enough that the doctor can rely on the patient's reporting or that they know them well enough to have their own sense of the rhythms in the patient's life.
And these days, everybody
days,
changes
that's-
doctors all the time because of their insurance plans make them change doctors.
Yeah, or the doctor's seeing patients every 3 minutes.
And
so,
that doesn't lend itself to really talking about fatigue. Fatigue, you'd have to talk about really to get a good sense of it for about half an hour, and that's the only thing you could talk about.
Okay, so fatigue is a really imprecise medical term.
Right.
It's used in the vernacular, much too broad stroke and not narrow and
has
precise.
too many causes to really trigger a physician going into the chronic fatigue workup.
Okay.
However, if they know the patient, then the workup would be doing all the laboratory for cortisol, 8 a.m. cortisol. If your cortisol is really high from stress, then your immune system is suppressed. So if we look at stress, your stress in life can actually be so bad that it stimulates your brain to make cortisol.
Because your body's in flight or fight mode. It's
Right.
prepared for the crisis.
And it wasn't meant for that. It was meant to be fight or flight, the tiger's running after you, or, a boulder's rolling down a hill, you have to get out of the way. So you have extra energy and you have extra cortisol to protect you. However, when we look at this in daily life, daily life, stress never ends. You wake up stressed, you go to bed stressed.
Who was it? H.L. Mencken said the average man leads a life of quiet desperation.
That's right.
In all of our lives, every day. Yeah.
The average woman leads a
Takes
life
care
of
of the man
chronic
that's
fatigue,
desperate.
but not in this fashion, because she's doing Christmas, Thanksgiving, all of those fun things that are our holidays to create.
Yeah.
So, it's that and everything else. But this is more than that. This is that kind of fatigue. When someone walks in, I can see it now. They like fall down on my table and they go, oh, I'm so tired. I'm so tired. I am never better. I wake up so tired. So what I do then is, if they haven't been diagnosed by a lab, I make sure I look through all their hormones, because of course thyroid can cause that. And of course, the high cortisol can cause that. But we also have to do viral studies. And viral studies,
Like
monovirus, you can have monovirus, and it can either be, it can come back after you've had it once. You'd think you're never getting it again if your immune system is low enough, or you can get a new monovirus, and then it never goes away. And there's a test for monoviruses to see if you have a recent infection or a long-term infection. We look at something called IgG for long-term, IgM for in the last 3 months. But there's a specific test called the eBNA test, and the eBNA test is the test that I do on patients, and that means the nuclear antibodies or antigens have become abnormal because of the monovirus. So this is the test.
Blood test?
It's a blood test. So that's the test I look for, because most of the time mono's involved. Now, the other things that can be involved, you can have lupus. Okay, and treatment for lupus or not treatment for lupus, and that's an ANA titer we look at, and that can set you up for having chronic fatigue. You can also have a problem with your pituitary. Your pituitary's gone.
We're going to have to continue this conversation in another podcast,
we are.
and we'll be happy to do so. But to pull just one point together, when Kathy says tests can be run and labs can be run, typically she's talking about blood tests. When you go to the doctor and they draw 2 or 3 vials of blood, they send that to the lab, and they have a checklist of probably 200 different tests that can be run. And the ability to know which ones to mark, to say, what am I looking for, again, comes from the relationship issue and the information content that you get from the patient. What are the kinds of tests that you would run if you were doing an assessment for chronic fatigue?
I would run several tests to rule out other diseases. I'd run a thyroid panel and a thyroid antibody panel, a blood count, and an ANA titer, which is a lupus panel, also maybe a rheumatoid arthritis panel.
Titer?
Titer is the level of immune cells that you have fighting your own tissue. It's an autoimmune test.
Okay.
That's a specific autoimmune test that I was describing. So,
All right.
Then you have several tests that we do to actually look at causes that are within the realm of chronic fatigue, like viral and bacterial. We look at the Epstein-Barr, the eBNA specifically. We look at the cortisol levels, 8 a.m. cortisol, and you should ask for that. Also testosterone levels.
Meaning that you check what your cortisol level is at 8
at
a.m.
8 a.m. because it's different throughout the day. So
All right.
an 8 a.m. blood cortisol, a testosterone test, as well as a growth hormone test. Because those two, if they are very low, can cause people to be susceptible to viruses and bacteria, so to chronic fatigue.
Okay.
So those are the tests that you would ask if you're getting blood work from your doctor.
Now, and when you talk about viruses, are there medicines that protect you against that, so that will help you fight chronic fatigue?
There are medicines that we use only after we've tried everything else. We've replaced everything else. We've tried nutrition and rest. And then there are some medications, one for viruses called Valcyte, CYTE, and it is very good at treating CMV and treating the Epstein-Barr virus. So we try that, but it's very expensive, rarely paid for by insurance, sadly, and it's generally used in AIDS patients who have CMV. So you have to make sure, I mean, if you know your pharmacist, that they know that you're treating chronic fatigue and not AIDS.
Not AIDS.
That might be a.
They'll be handing you the packages gently.
Yeah. And you know, if you don't have it, you don't want to have everyone think you do. So,
Sure.
So the other issue, or the other type of chronic fatigue, is a bacteria, and all the bacterias are actually responsive to a tetracycline-like drug.
Okay.
Okay, so fibromycin would be one of them, and we use a lot of other medications, just straight tetracycline, but you've got to take it forever. I mean, like a year to get rid of this.
And can the test distinguish between the viral and the bacterial, or do you need to take both forms of the drug?
No, the test will tell you what caused this. And I forgot a Lyme titer too. You should have a Lyme disease titer. That's one of the bacteria that can actually cause this. That's a tick-borne disease, and it's also sensitive to tetracycline-like drugs.
Okay.
So those are the
And that's one of
ways
those 40
we
diseases that doctors have to eliminate, that you don't have Lyme's disease before they can diagnose you for chronic fatigue.
well, you may have chronic fatigue from Lyme's
And
disease.
From Lyme. Okay.
And so Lyme's can cause that, mycoplasma can cause that, and chlamydia can cause it. Those are the bacteria that can cause chronic fatigue that you need to be treated for, and it has to be a lengthy treatment, not a 10-day treatment,
Okay.
like you would normally have if your immune system was intact. The big problem with chronic fatigue is you have a subpar immune system when you get the virus, and then it's a never-ending cycle because the chronic fatigue then makes your immune system worse. Your immune system can't fight it, and then your chronic fatigue gets worse. So it's kind of a spiral down. So you have to stop it some way, and by treating the element that actually caused it, viral or bacterial, is about the only way you can really get on top of it, besides stimulating the immune system.
So in terms of fighting it, once it's been determined that you have it, which is a difficult determination, there are lifestyle strategies, medical strategies that you need to follow.
Well, you have to act like, or you'll feel like you have mono, so you have to treat it that way. You have to have rest and supportive treatment, meaning lots of fluids, lots of vitamins, good food, healthy food. Some people use or take out additives and things like that. I'm not sure. There's no study that shows that helps, but that might be a good idea. So improving your lifestyle, rest, exercise, if you can, unless it's so exhausting that you can't. We try not to push anybody that way. Would be the best way to just do things yourself. Don't smoke, don't drink, all of those things impair your immune system. So, just a really healthy life, and then get it diagnosed, then see if there's a treatment for what you've had diagnosed.
Okay.
And in my world, replace your testosterone and estrogen first before you go to Valcyte, which may be $500 a pill.
And have side effects that are pretty disturbing.
Right, and have liver and kidney problems. You have to monitor that the whole time you're on Valcyte.
So to summarize, what we're saying today is that chronic fatigue is a real, legitimate, diagnosable problem that physicians recognize and have a protocol for diagnosing. It can come from multiple sources, and it can be treated in multiple ways. And what Kathy is saying is that replacement of testosterone and estrogen through bioidentical pellets results in at least 70% of her patients that have chronic fatigue, not just 70% of her patients overall, but those that have been diagnosed with chronic fatigue, reporting that they are improved and that they feel better and that the chronic fatigue is not an intense concern anymore. They get better. And they have to be responsible for themselves in terms of diet and nutrition, exercise, following the medical protocols, but these pellets will help you get better. If you have questions about that, or if you're dealing with chronic fatigue and would like to consider that as a treatment protocol, you can contact Kathy directly.
At biobalancehealth.com at our website, and you can fill out the questionnaire and send it in and get your blood work, and we'll see if we can help you with testosterone. If you have other questions, you can write podcast at biobalancehealth.com.
Or you can contact me for the other questions at brettnewcomb.com.